Good evening. Today is Tuesday. Today is June 24th, 2020, and it is 5:35. As a quorum of the board is in attendance via our video conference, I would like to call to order the meeting of the Central Health Board of Managers. The first item of business is public communication. Members of the public who wish to make comments during the public communication portion of this meeting must have registered with Central Health via the online form or by telephone no later than 4 p.m. today. Yvonne, did anyone register to make comments?
Yes, Madam Chair, we have one member of the public who wishes to provide comment.
Okay, then Yvonne Davila of the Central Health Communications Firm will briefly cover the guidelines for the public communication portion of the meeting, and will then introduce all of our speakers by name and invite them to speak in turn. Once you are recognized, unmute your phone or computer, state your name, and provide any comment. There's a 3-minute limit for comments per board rule. Yvonne?
Thank you, Madam Chair. To be recognized to speak, you must request a speaking slot using our bilingual online form or by leaving a voicemail by 4 p.m. the day of the meeting. Individuals are asked their preferred language as they register to speak, and both the online and voicemail greeting are in English and in Spanish. All speakers will be recognized by name and in the order their speaking request was received. Please keep your phone muted until you are called on to speak. Please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Once again, speakers will be muted at 3.5 minutes to ensure the efficiency of the meeting. Speakers may not donate their time to other speakers. As a courtesy to others and to be respectful of time constraints, please try not to repeat other speakers' comments. Depending on the number of speakers and the total time being spent in the public communication portion of the meeting, the board chair may, in her discretion, impose additional limits on time or comments. Due to the restriction of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. Madam Chair, at this point, I'd like to call on the first and only speaker to provide comment. Her name is Susan Dawson. Miss Susan Dawson, if you can please unmute your line.
Can you hear me now?
Yes, we can. Thank you.
Good afternoon, members of the managers, and I appreciate your providing this time to me. I would like to speak. This is Susan Dawson. I'm speaking as a private citizen of Travis County. I would like to speak on 2 items, regional cancer care for the uninsured population in our region, and specifically how MD Anderson potentially fits into that ecosystem. First, just very quickly, you all as managers have seen some statistics about cancer care in our region. But I would like to reiterate that unlike most of the country and the state, cancer is the #1 killer in the Central Texas region, and this is uniquely an issue for our uninsured population who have a life expectancy after a cancer diagnosis that's barely over half that of the Texas average of those who are uninsured and have a cancer diagnosis. So it's an urgent issue. Members of Central Health knows this. In the past, you've had to allocate emergency funding to cancer waiting lists. You have expanded negotiations for contracts with specialists to serve MAP patients and have worked to address this community. In addition, there is a regional organization called Central Texas Addressing Cancer Together that has been formed to address this specific need. It's a coalition of all providers in the region, including Central Health, Ascension Seton, St. David's, Baylor Scott and White, Texas Oncology, every FQHC in the region, community activists, researchers, et cetera, who have been working for almost 2 years to address this need. We appreciate that Central Health has been involved in this and has acted to include expanding access to mammograms and screening for MAP patients, to starting a cancer work group before COVID anyway. I know many things have changed tactically. Members of Central Health and your leadership team, including Mark Hernandez before the CCC reorganization, Monica Crowley, Katie Coburn, and others have been very materially involved in this. We have worked together to develop a plan to redeploy the bus for mobile mammography that used to be run by Ascension and will be run by Lone Star Circle of Care. There are many other ways that Central Health has been an integral part of this, and we thank you for that. Going forward, we anticipate, and in fact there is active discussion going on now, that MD Anderson is interested in expanding to the Austin area in partnership with UT Austin and Dell Medical School. This is something that UT System supports and wants to continue to build on the excellence of the MD Anderson service capacity and brand to be able to offer those specialties in Central Texas that don't exist in cancer now. However, there is a severe issue with this for our community, which is to say that traditionally, MD Anderson has not been active in serving the uninsured. They do provide some ways to support other organizations, but through MD Anderson, you cannot be served as an uninsured patient or even a patient with Medicaid or many ACA plans. So we're requesting that as these negotiations continue, that Central Health will certainly be part of this by means of the $35 million that is allocated from the tax base of Travis County to support Dell Medical School.
Mrs. Dawson, I'm sorry to interrupt. You
Yes.
have 30 more seconds. Please go ahead.
Thank you. So I'd like to make sure that we iterate that it's imperative that should MD Anderson come to town, they're part of this ecosystem to serve not just MAP patients, certainly MAP, Medicaid, uninsured patients throughout not just Travis County, but the region. And we hope that Central Health will be part of this and prioritize it going forward.
Thank you very much for taking the time to speak with us in our public communication. We very much appreciate and all of your hard work in the community. Thank you so much.
Thank you.
Yvonne, is there any other public communication?
No, Madam Chair. This concludes the portion of public communication of this meeting.
All right. Thank you very much. We will now proceed to the consent agenda. The consent agenda, C1, accept a report of the May 2020 financial statements for Central Health as recommended by the Budget and Finance Committee. C2, accept a report of the May 2020 financial statements for the Community Care Collaborative as recommended by the Budget and Finance Committee. C3, approve the execution of a lease agreement for the Eligibility Call Center as recommended by the Budget and Finance Committee. C4, receive and ratify Central Health investments for February, March, and April 2020. C5, receive the quarterly investment report. C6, approve the minutes of the Central Health Board of Managers February 26, March 25, and May 27, 2020 regular meetings, April 29 and May 6, 2020 special call meetings, and April 15, 2020 emergency meeting. Is there a motion?
I move that we approve the consent items C1 through C6.
Is there a second? I have a motion by Manager Valdez. There's a second by Manager Oliver. All in favor, please say aye. Aye. Aye, members. Opposed, same sign. Any in opposition? Any abstaining? Okay, thank you, members. Members, we will now move on to the regular agenda. Members, we will be taking our agenda out of order this evening. Due to its expected length, item 1 will be taken up last. We will also take up item 4 after item 2 so that the order of the agenda will be as follows. Item 2, item 4, item 3, followed by item 1. To be respectful of everyone's time, I would like to take up item 1 at 6:30 p.m. at a time certain and end all other items by 6:25 to give you time for a short break before starting item 1. Therefore, I will be monitoring the time with the help of our council and other staff for presentations and questions on the other items. So we will now proceed to the regular agenda. Item number 2, receive an update on the Central Health President and CEO's performance evaluation tool for the period of June 2020 to May 2021. Susan Willers will be presenting. Susan?
Thank you. Good evening. Very brief update. We are continuing to research on the previous recommendations made by the Board of Managers last month. We're continuing our research and don't expect to bring back to you all a draft until sometime July or latest August.
Thank you, Ms. Willers. We appreciate that you're following up and researching those additional items and aspects, and we'll bring them forward by August with a draft evaluation tool in your research. Thank you. Managers, any questions or comments on this item? I'm looking, I don't see any. Please shout out if there are. If not, then I will move to agenda item number 4. So not seeing or hearing anyone who wishes from the board to speak on this or ask questions, I'll move to agenda item number 4. Receive and discuss updates on the Central Health Enterprises responses to the current COVID-19 pandemic, including changes in healthcare and administrative operations, coordination with local disaster response efforts, data from community care testing sites, and related fiscal issues. We will have presenting Mike Giesland, Ted Burton, Kit Abney-Spells, Sarita Clark-Leach, Dr. Jason Fournier, and Yvonne Camarena will be presenting, and I'm going to turn it over to our presenters now. And I would ask that we hold call questions till the end so that we can be efficient.
Thank you, Madam Chair. I'll kick off the update on our COVID response efforts and then hand it off to Mr. Burton. Currently, the organization is still operating in a disrupted business environment at what we call a level 3, which is we're going to continue to remote work through July 10. We're going to reassess this given the infection rate increases and the need to be operable, but also to keep our employees and our visitors and our vendors that are in and out of buildings healthy and safe. Second, on the community response, Brianna, if you could go to the next slide. Thank you. So I'm on bullet number 2, the community response overview. Contact tracing. I'm going to speak quickly to our current efforts, but I need you to know that the thought processes around contact tracing are fluid. There's an emerging conversation among medical experts that contact tracing has certain limited values unless it can be done quickly following fast turnaround of test results. And there are practical ways for people to isolate or to cocoon situations. Nevertheless, we are still proceeding with our joint internal task force between CUC and Central Health, Community Care and Central Health, and working on how we would operationalize contact tracing for community care's positive cases. And as a matter of principle, we are going to work with staff and groups to ensure that our efforts under community care's work are culturally aligned and connect with the people that we serve and are contacting. Also related to contact tracing, our finance teams are working on possible reimbursements from city, state, and federal sources. To this end, Jason and I have co-submitted a request to the city, and we'll follow up this week and next week in terms of additional reimbursement sources. Task forces. You'll recall that part of the community response organized under the Emergency Operations Center involves a number of task forces, and we have staff that are participating in this, and it ranges from just monitoring calls to make sure we're gathering information and intelligence and passing it along, or direct staff participation. I'll point out 3 tonight. One is the Alternative Care Site Planning Task Force. The other is Mass Casualties. The other is Social Services Task Force. Most pertinent to today's discussion is the Alternative Care Site. As you may have heard already, we will start this community under the Emergency Operations Center in Austin Public Health. We'll start setting up an alternative care site. And the way I would think about this is, think of it as a field hospital or perhaps an infirmary for those with low acuity. So this will not be a place where you have ventilators, for instance. I think the target capacity right now is somewhere between 1,000 and 1,500 persons within this site, and the city is working with the Travis County Medical Society, the Convention Center, other medical providers and surgical centers to work on the staffing in addition to the logistics for the site. We have staff that are actively engaged in this alternative care site task force, and one of our principles is that this is an important part of a pandemic response, but what we don't want it to be is a place that MAP patients or the uninsured go as a first resort. It is, again, low acuity based on medical conditions in need, not payer source, and that's an equity principle for us, and we're going to stand fast to that. So I'll turn it over to Ted Burton.
Good evening. This is Ted Burton. I'm Vice President of Communications. Tonight, I want to briefly share with you a few highlights from our Grassroots outreach, and I'll begin with our outreach to MAP members. I've reported on this before, but want to give you a quick update. Working with community care, we are targeting people and communities that are disproportionately affected by COVID-19, so specifically the Latino and Black communities. But beginning with our MAP outreach, we have contracted with community health workers to continue to reach out by telephone to MAP members. And these are people who may not have access to the internet, providing them with vital information regarding not only just MAP, but COVID-19 testing sites, prevention, information, including resources like housing, food, and how and where to isolate if they can't remain at home and if they're positive. So far, we focused on 9 zip codes. You can see those zip codes on your screen. And our community health workers have made more than 3,000 calls and reached nearly 1,800 people. I want to give a quick shout out to my colleague, Isela Guerra, who's been supervising this outreach initiative since the beginning of COVID-19. And we are so grateful to our community health workers for what they're doing to help reach this very vulnerable population. Next slide, please. I mentioned before that we have developed a campaign with invaluable input from community members and groups like the Austin Latino Coalition. On your screen, you see a campaign logo and theme that our team created. It's protect yourself, protect your family, or protéjase e proteja a su familia. This is now a logo that we are including on all the materials that we're producing. And we've also shared it with our partners like Austin Public Health and any organization that wants to use this. They're welcome to use it and co-brand it, meaning putting their logos on it, or use it as is. We are in the process of onboarding 2 different community consultants to assist us with a very aggressive business outreach, business and faith-based outreach. We are focusing on zip codes that include people that are disproportionately affected by COVID-19, which I've mentioned, based on community care numbers, the Latino and Black communities. We are developing a resource kit for businesses that are either owned, serve, or employ a large number of people who are disproportionately affected by COVID-19. These kits will include information about testing locations, prevention, and then resources in case they test positive. And also, we've been asked to help inform the community about self-isolating and the isolation facilities where people can go and safely isolate from their family while also making sure that their family is provided for. We're also going to include decals or signs for shop windows regarding wearing masks. I want to show you the next slide, please. This is just an example of one of the collateral materials that we developed under the Protect Yourself, Protect Your Family logo. This again is in regards to how to safely isolate at home or to access the city's isolation facilities. We used information provided by Austin Public Health and just simplified it and added the Protect Yourself, Protect Your Family logo. And this will be distributed to businesses, faith-based organizations, and more. And it's also available on our website. And then the final slide, please. We are continuing to produce content. I hope that you have visited our website where we have a social media toolkit. This content is available and is shared with our partners and the community. Our latest video series under the Protect Yourself, Protect Your Family theme features community leaders delivering critical health information in English and Spanish. And I would like to show you two tonight. They're very brief. But I also like to let you know that we are shooting most of these videos in-house, thanks to Edwin Evans and Anastasia Sims. I just can't say enough about my amazing team that I'm honored to work with that can produce this kind of content so quickly. Just to give you an idea, we've produced 35 videos since this outbreak began, and we have 10 more that are currently being edited. And we do have assistance from one of our partners, Han Texas, with some of the shooting and editing as well. This is a team effort between Community Care and Central Health and our community partners. And sometimes we even pull in Perla Cavazos to play reporter, like she did with me this weekend. When we shot this first video, you'll see with Father Mark Hamlet at the Sacred Heart Catholic Church when we were on site this weekend for the testing event for construction workers. Brianna, could you play the first video?
Quiero decir a mis parroquianos y amigos, usan su máscara, por favor. Protéjense con su máscara y mantienen la distancia. Entonces, por lo menos 2 metros entre personas que se protegen. Yo soy el padre Mark Hamlet, soy el párroco de Sagrado Corazón en Austin, Texas. Protéjense, protegen a su familia. Gracias.
And I can tell you the audio is perfect if you listen to it, not online. I'm not sure what it sounded like for you, but the audio sounds really good when you hear it the way it's supposed to be heard. And then one more video for you. We shot and released this video in honor of Juneteenth, and it features a well-known community member that you may recognize, Miss Barbara Scott.
My name is Barbara Scott. I am the president of the Colony Park Neighborhood Association. I represent Colony Park and Lakeside Hills, which is in the Colony Park area. We have one of the highest rates of heart disease, diabetes, chronic illnesses in Travis County. Being of a senior age, it is imperative that we protect ourselves. That means wearing face masks, which cover the nose and the mouth, washing our hands for at least 20 seconds with warm water and soap, staying at a distance from people that are not related to you and live in the same household. We may need to make sure that we are responsible for our health, keeping in mind that we don't have the health care in this area that we need and deserve. We must maintain the proper COVID-19 safety measures. Protect yourself, protect your family, protect your loved ones, protect your friends.
With that, I'll conclude by just encouraging you to please, if you can, share these videos and share the content that we're producing on your own social media platforms and within your own networks. And I appreciate your time this evening.
Next speaker, please.
Good evening, managers. This is Kit Abney-Spels, and I'll provide a quick update on our MAP and MAP basic enrollment. As you will recall, we had extended all individuals' coverage who was to expire between March 15th and May 31st. Therefore, our enrollment during the weeks of April through the end of May only continued to increase as individuals did not have coverage expiring. June is our first month in which individuals were naturally expiring in the month of June, as well as those that would have expired between March 15th and March 31st are now expiring in the month of June. So we are closely monitoring the impacts in enrollment, and we have seen more and more applications. So we will have more information in our future months about what we think is going on with enrollment. I did want to make you aware of 2 questions that have been added on our online application. There was a desire to know if folks were actually applying due to a loss of job from COVID-19. And as you can see here, we've had over 2,400 responses, and 88% of those responding stated no, they had not had someone in their household lose a job due to COVID-19. We also asked if a member of their household lost their employer-sponsored insurance due to a recent job loss. And as you can see, 61% responded no to that question. That was the extent of my update this morning, evening, as I know we're pressed for time. Thanks.
Thank you. Next speaker, please. I believe you're on mute. Sarita.
Hi.
There you go.
This is Sarita Clark-Leach, and I'll be presenting on the COVID data update as of June 22nd. And this first slide that you're looking at should be somewhat familiar. It's showing that increase in the number of confirmed cases over time of COVID infections in Travis County. And you'll note that there was a significant increase from June 8th to June 20th, and you have your the volumes here of number of cases per 10,000 residents, along with your doubling time. Now remember that yellow line that shows doubling time, we want that line to be higher rather than lower, so that inflection point on the 8th, where we start to see that doubling time decrease, does indicate that the disease is spreading more rapidly than it has in previous weeks. And the timeline of that that we're looking at here just makes it that this spread may correlate to that Memorial Day weekend and the relaxation of social distancing guidelines. Next, please. May I have the next slide, please? Okay. And so this is a representation of new cases, and this is from the Travis County and Austin Public Health website. But this is meant to show that there was a day, I believe it was the 18th, where we didn't have reported numbers, and so some of this uptick could be attributed to the fact that they were accounting for those numbers in later dates. But the fact is that there still was an increase when we look at an estimated active case rate. And I'll talk a little bit about that. We do see that active case rate has increased as well. So, when we've looked doubling time and we've been looking at the number of cases, we tend to use the confirmed case number as the measure that we're pursuing to figure out the spread of the disease in the community. But a more accurate metric might be an active case rate, and that can be done by estimating about 2 weeks worth of new cases, and we're summing 2 weeks because that's about as long, and that's a conservative number. It's about as long as the disease may take hold of someone. So again, looking at it at an active case rate and a per capita active case rate gives us a better sense of who's contagious, who may still be contagious in the population, and may give us a better sense of spread. Again. Next slide, please. And so you'll see in an appendix of this presentation that we have the zip codes that are carved out that we should be paying attention to, and those zip codes, again, they overlap with the zip codes that Ted's team is doing outreach to, and those are those South Austin neighborhoods, the 7741, 43 Runberg. And there are additional neighborhoods in there as well. And you'll see some areas where we've noted some growth, again, relative to these different metrics that we're looking at. So rise in confirmed cases, active cases per capita, new cases, et cetera, and doubling time. Next, please. And then finally, we wanted to make sure to bring to your attention the fact that we've moved from stage 3 risk-based guidelines relative to APH's scale, because we've moved into 20, we're now at about 27, 28 new admissions daily. And again, you know, the next time that scale, that will move up the scale is when we get to 70 or more than 70 admissions. So we want to keep an eye on it, on making sure that we have our the folks with whom we're doing outreach follow the guidelines that are necessary to mitigate the spread of disease. And that's all I have today. Thank you.
Do we have another presenter, I thought?
Yeah, it's Manager Greenberg, it's yes. Chairperson, it's Jason Fournier here.
Okay.
I just saw my slides, but they're gone. And so okay. I don't know if, I can certainly share from my computer.
Brianna is sharing, yes.
Okay, thank you.
I can go ahead and share if it's easier. Okay, perfect.
Something has appeared, so proceed, thank you.
Yeah, no, thank you so much, Chairperson Greenberg. So good evening, Board of Managers, Jason Fournier, CEO for Community Care Health Centers. It's my distinct pleasure this evening to give you an update as it relates to our coronavirus response and just an update very quickly overall in terms of where we're at community care. So four of mine, of course, for us at community care continues to be both the safety of our staff and our patients, and continuance of securing our personal protective, our PPE supply chain. We're in a very positive position relative to both of those, especially considering what Sarita just presented, which is increasing cases within the community. So it's increasingly imperative and has been since mid-March that we stay vigilant as it relates to our protective measures. But of significance to date, and this may have been updated earlier today, I haven't seen the most recent update, but from yesterday, we actually had 21 of community care staff members have tested positive. But out of those 21, only one is thought to potentially have been exposed in the line of duty as part of their work. The other 20 are actually community-wide spread. And so that says a couple different things to us. One is it means that the effective measures that are in place are working, but again, we can't let our guard down. And then when we take a look at that, it also means that we have to engage with our employees and community at large in terms of ways for them to better protect themselves as well. And so when we look at some of the access that's been created over the last several months, very proud to report that to date, we've provided over 15,000 tests. My guess will be is by the end of this evening, that'll be close to about 15,500, of which, and these are data that we haven't shared widely before, but thought it would be good to share with you this evening as Board of Managers. 72.5% have been City of Austin residents. 82.6% have been Travis County residents. 96.5 are from counties within the Austin MSA, so the 5 counties that comprise that MSA is listed. And then you can see the breakout of where our testing is been. It almost aligns very appropriately with our demographics from a patient perspective overall. It's a little lower for our African-American population and our Asian population by a couple percentage points on both sides. But what's important to note is that of the 15,000 plus tests that we provided, roughly 37% have been provided to community care patients. The other tests have been provided to community members at large. We do feel like we're drawing mostly folks who should be served by us, who don't have other options. But I'd be lying to you if I said there aren't folks who do have other options that have found their way to our testing sites simply because there isn't as much capacity as needed, especially of late. And there'll be a slide here in just a moment. The other thing is that, as you're aware, we were the first to go ahead and start testing through our relationship with Centene and Quest Corporation, Quest Diagnostics, asymptomatic non-exposed individuals. And for the week of June 13th through June 20th, so last week essentially, we had an average positivity rate of 7.5% for folks who had no known exposure and no symptoms. That's higher than what we were expecting, and so we're going to continue to do that. The other is similar to what Sarita and what we're seeing at the county level and the city level. Demand for services has increased tremendously. 2 weeks ago, our hotline was averaging about 200 calls a day. Last week, it averaged 600 plus calls a day. Next slide, please. And so thinking about our services as a whole, because we've been providing updates mostly around our coronavirus testing initiatives, I think it's imperative that the Board of Managers also have awareness about our current clinical care services. So only 3 of our sites continue to be offline, and those are our Austin OBGYN clinics, our Riverside, Springdale, and Manor. That was partly because we wanted to concentrate our efforts at a couple of our OB hub sites. We're still assessing when those will be coming back on. But just as things were starting to become more and more restored within our environment, within our clinical care environment, now we're seeing an uptick in cases as it relates to coronavirus spread within the community. But we've been restoring our preventative services, mammography, iris scanning, other things. Well child and adult wellness physicals have also been reinstituted. A lot of this is based on patient preference, and so we really take our cue if they prefer telemedicine or telephonic. That's how they'll be scheduled versus if it's in clinic. We're also averaging about 78-79% of our normal daily encounters, and you can see down at the bottom as it relates to the percentages. So we're sitting about 46-47% of the services we are providing are still being provided by telemedicine and telephonically, and the vast majority of actually is via telephonic services. Next slide, please. And so this is just unbelievable graphic about our team's effort, right? You can take a look here on May 11th is when we started getting those additional tests from Quest. Took us a little bit to ramp up, but the last 2 weeks, it's just gone straight up, right? You can see 2 weeks ago, we did almost 2,500 tests. Last week, we did 3,600 and plus 3,628. You can also see the breakout, the orange line here. So the blue line's in all tests, including our drive-through testing sites and our health center testing. And then coupled to that, the orange line is our Hancock drive-through. And then notably, the green line is as it relates to our Eastern Crescent, or Eastern Travis County initiative, which includes Dove Springs, Pflugerville, Del Valley, Austin's Colony, Hornsby Bend, Colony Park, and Manor, where we've got drive-through testing going on. And so very significant. Next slide, please. So overlaying that testing, and you can see here again in blue, gray, and yellow or orange are the various different testing initiatives that we've got going on across the metro area. But overlaid with that is the positivity rate. And unfortunately, as we've increased our testing, we've seen a significant increase in our positivity. Up until last week, we were controlling our data on the positive side on trending relative to the asymptomatic non-exposed. Frankly, we decided there was no need to do it this week or last week for last week's results, simply because it had spiked so much. If we controlled for it and gave this a true trend, it would probably be closer to 32% overall. The green line that you're looking at, as well as the positivity rate, similarly to the red line, overall positivity for all populations, ethnicities tested. Green line is for our Latino population. And so you can continue to see that over time, it's increased. And last week, unfortunately, was the highest level of positivity that we tested out of the tests that we conducted. We've got about 2,800 of the 3,600 tests back. We've got about a 4-day lag time there, and it's 36% positivity. Next slide, please. And so one of the things that you may be aware of is that we have created an online dashboard that's updated daily. And there's, on this screen here, there's a whole, it looks a little busy, but it's not too bad when you go to the website. It's hyperlinked. You can also get to it by going to Community Care's webpage, and then at the top, there's a coronavirus dashboard hyperlink that'll take you to it. But we've trended the last 4 weeks of positivity overall, then we're showing test results by day. We've broken out by age, broken out by language, CUC patient status, and then by insurance. And then you can see trends by race, ethnicity at the bottom left. The one thing to point out relative to the maps are interactive. And the second map, which is tough to see here, but is the top 20 zip codes we've tested. We're looking at all zip codes on the screen right now. And if you blew this up on the interactive map, you would be able to see not just in Central Texas, but further on, where we've actually had a couple of folks who were tested from Seattle. How they found their way to us, I'm not quite sure. But that notwithstanding, the second map goes ahead and looks at top 20. And then you can click on the map, and this is as of June 19th, and it'll be updated again by the end of this week. But you can see our penetration level, both for the population at large by the zip code, and then also for low-income populations. And then we've ranked them as well. So our number one tested zip code is 78753, which is the Runberg community. Close second behind that is the Dove Springs community. And those are areas where we're seeing a high level of positivity. When we look at penetration, though, from a low-income per capita perspective, actually Colony Park and Austin's Colony Hornsby Bend come in within the top 3-4 zip codes that have been tested per capita from a low-income perspective, just so that the Board of Managers, each of you, have awareness around that. The blue stars on here represent our testing sites. You can actually click on those and see the hours of operation. And so if you advance to the next slide, just a very quick update on our hours of operation. We've had to make a very difficult decision about changing how our outdoor drive-through testing sites are operating. If you went by our Hancock site or any of our sites, frankly, last week or even this week, they're filling up very quickly. We had lines at Hancock that were going out the back of HEB by 8 o'clock in the morning last week. Unfortunately, yesterday, due to the inclement weather, we had to call our testing sites. Weren't able to test yesterday because of the lightning that occurred. But to provide relief and keep our staff safe from heat exhaustion and sunstroke, we've decided to reduce the hours at our sites, but still maintain capacity. And we're doing that a couple different ways. We also engage through Central Health, and thanks to our partners at Central Health with your advisory councils, to look at alternative locations and doing this slide. But we decided that it was best just to stay where we are right now. And so as of Monday of this week, we reduced our testing hours from 6:30 to 1:30. And we didn't really lose capacity because there was a lunch break in there that was going on, and we were going from 9 to 4 before. So functionally, the hours are the same. It's just trying to get away from the heat of the day as best we can. So that was at our Hancock, William Cannon, and Pflugerville locations. Next week, the rest of our sites will follow the same schedule, and we're in the midst right now of ramping up an evening team from Hancock that will go from about 4:35 till 9:30. We're going to take our cues from the community. I do have to communicate, though, as we've ramped up services, we've also gone ahead and hired staff that are very specific for our testing initiative. So we're currently recruiting 50 additional team members, many of which have been actually secured. I think we only have 4 positions still hanging out there right now as of earlier today. And that's critically important for me because we're balancing providing our overarching services to the community at large as a large primary care safety net provider with the need to maintain testing. The other thing I think, and you can advance the next slide as I'm just finishing up here, for us, this is all about equity, and in particular health equity, and making sure that those in our community have access to the care they need and deserve, and that includes testing. So one of the things we are struggling with is again, folks who have other options, we're asking that they go to the other options and conserve our resources for those that are our patients or who are uninsured, underinsured, or lower income who really don't have other options to get testing done. The other thing is just very candidly, our testing sites have been overwhelmed the last week. And we're hearing from our colleagues at APH that they're very similarly positioned. I learned earlier today, based on a text message, that right now APH's next scheduled appointment apparently is July 11th. So as unfortunately we're seeing the rise of cases in the community occur, we need to be honest that testing is not going to keep up with the spread. And so one of the strategies that we have and have been using for some time, but we need to reemphasize this, is that anyone who comes through our testing sites, if they're symptomatic, they are going to be informed that they have coronavirus until we tell them otherwise. And I think that's the message that needs to be sent. Don't wait for your test to believe that you might have coronavirus. We all need to be acting as if we have coronavirus, especially if you're symptomatic, regardless of what the test is. The test is just confirming what most of us are going to have if you have symptoms. We're not in flu season anymore, so I think that's a strong message that we need to be sending as a community, especially when we're seeing 36% of our Latino brothers and sisters coming through our sites infected, when we're seeing an increase across all of our populations, and notably across all ages. Our 18 to 64-year-olds, based on last week's testing, actually came in at 28.6%. Our older population, 65 plus, came in at about 32%. And then our younger population was just a hair shy of 32% at about 31.6%. Now, the vast majority of our tests are 18 to 64, of course, so that's a larger sample size, but all this is statistically significant, folks. So we're continuing to partner, and the other thing is that our information now is being fed into a consortium of testing initiative. So hopefully next week, Austin Public Health Department will be in a position to share similar information across the community that incorporates our info and info from all health systems. And with that, Madam Chair, that concludes Community Care's update for this evening. We appreciate the opportunity to present to you as always.
Thank you so much. So is there anyone else who intends to speak on this item? I'm not hearing or seeing of anyone. I want to thank all of you for your dedication and your excellent presentations. And I know that there are many other staffers behind these presentations, so please thank them for us too all across our enterprise. I do have a couple quick questions and I'll open it up. Ted, I just want to see if you can make sure to send the board members, since you would like for us to help distribute this, emails that have the logo that we can pass on, as you mentioned, and also those, I'll call them flyers that you had in Spanish and English that had messages, and I think there were a couple of videos. So I would find it helpful to just get those in an email that I can then pass on. So I'll ask that. And then I just do want to say that while we were on, I quickly switched to today's dashboards that are on the City of Austin website and Travis County. And I think we had 56 hospitalizations again today. I'd have to switch back, and over 300 new cases today. So this is unfortunately continuing a very alarming trend that we've seen in some exponential growth with that. And again, I just know what a workload this is, and I say this for all of the staff, given these increasing positivity rate, increase in tests, increasing cases, increasing hospitalization. So we thank you. And members, questions? I think I see Manager Musaitif, and then Manager Jones, and then Manager Valadez. So if we can go in that order, please.
I'm sorry to interrupt, but you told me to remind you, it is almost 6:25. It is 6:24.
Oh my goodness. Any quick comments? It has to be very short. Manager Musaitif, I cannot hear you. Do you have a very quick comment? I can't hear you. Can anybody hear her?
Hear me now?
Yes, but you're gonna have to shout.
Oh, I don't know what the issue is.
Okay, make it very quick, please.
Mine is really, really quick. Related to what Jason just mentioned. Thank you so much for the presentation. I think we need to make this really a good message that I found it very powerful, what you stated. that we all have to act as if we all have coronavirus. I think that's a strong message that we need to share with the community, given the 7.5% positivity rate among asymptomatic and the inability to test everyone. So if we can.
Thank you.
Thank you.
Any other, very quick, because we will need to go to our a time certain for our closed session that I'll have to announce.
Sherry,
Jones, did you think quick?
excuse me, Sherry, I just also want to say that if anyone has any questions, they want to email me or Brianna, I can
Okay.
also give answers.
Okay, Manager Jones, I know you had your hand up quickly.
Well, I'll defer mine to another time. I do have some questions for both the, regarding the African American outreach effort here. I didn't see a lot, particularly in zip code 78653, 78660, nor did I see a logo particularly focusing on the African American community. So I'll talk about that another time. Given the limited
Is
time.
Ted Burton still with us? Ted, could you communicate with Manager Jones on that? Yes, okay. Manager Valdez, did you have something very?
Yes.
We can talk
I can
offline.
do that. And the logo, by the way, is not, it's for the African American and Latino community. It's both. So we
Yes, I
essentially made it
understand.
bilingual.
I understand. Okay, so let's, if you could please get with Manager Jones offline and address his questions. Thank you. Manager Valdez, you have something very quickly? I can't hear you. You're on mute, Manager Valdez. You're on mute, Manager Valdez.
I just was gonna make sure that we were not going to be asking people to fill out 10,000 forms, including provide documentation that you were born here in the United States. That's all.
All right, we'll let you address that.
In some places, they're getting that.
Okay, I'm going to ask that you send that to Brianna, and she can then route that to the appropriate channel. Thank you. All right, members, given the time, I think that we will have to postpone agenda item 3 for a future meeting. I understand from staff that that's something we can do. Is that correct, Monica?
Yes.
Okay, so we're going to postpone, given the time, agenda item 3. And I am going to announce that we will take up agenda item number 1 very quickly. I'm going to give everybody about 5 minutes, though. It is consider and take appropriate action on a complaint made against the Central Health President and CEO pursuant to Central Health's complaint resolution policy for employees who report directly to the President and CEO. Members, we will proceed directly into closed session, where we will receive presentations from the parties in the order anticipated by the complaint resolution policy. Therefore, I announce that the board is convening in closed session to discuss agenda item number 1 under Texas Government Code section 551.071, consultation with attorney, and section 551.074, personnel matters. Members, I'm going to say we're going to start at 6:35 instead of 6:30, so people can have at least a 5-minute break, right? And it is very important now. Who is going to be in this closed session as far as staff? Holly, can you inform which staff will join the board members in this?
So staff for Central Health will be Monica Crowley, and Mike will join us initially, and then we'll ask him to leave and come back on.
And you will be joining, right?
Correct.
Okay. And anyone else we need to be apprised of at this point?
Leslie and Shireen, both from the county attorney's office, will be joining us as well.
Okay. And so no one else should be on this. Everyone must completely terminate this meeting. Perla, were we sent just now an email?
Yes. Brianna, just as a reminder, sent an email right now with the link to the closed session meeting,
Okay.
but you should also have a calendar invite as well with a link.
Okay, so everyone completely terminate this, and I will meet you at 6:35 in the closed session. Thank you. I don't think that Manager Zamora ever rejoined us, did he? Was ever
Did
able to?
not.
But I think we're still waiting for Manager Jones. I see Manager Valadez, Manager Oliver, Manager Bell. I think we're still waiting for Manager Jones. Is that correct, to rejoin us?
And we need one more person, or technically the meeting just dissolves.
Okay, well, it may just have dissolved it, because if we don't have Manager Zuniga back, then it just dissolves. And nobody has to make a motion to adjourn if we dissolve. Anybody ever, when you were a kid, make rock candy? Which to me now, I cannot believe you put the string in with the sugar water. And yeah.
And it crystallizes.
That's what it's making me think of. It's kind of the opposite of that.
Yeah.
Mm-hmm. Pull our own taffy. Anybody do that either?
Oh, yeah.
Yeah, yeah. Mm-hmm.
Made paste. No, what was it? You would add that almost plastic looking thing to make candy as a Girl Scout.
Yeah, that too.
Or brownie.
Okay, does somebody want to text Manager Jones to see if he's, well, it doesn't really matter. I guess if Manager Zuniga's not rejoining, then we dissolve. Is that correct, Holly?
If Jones came back, we would have 5 people.
Correct, Cynthia.
Okay. Yes.
I just texted Julie Zuniga to see if she's coming back.
Well, somebody needs to text Manager Jones, because yes, if either one of them comes back,
I will text him.
Then we must adjourn. If neither one of them do, then we just dissolve. We're just so sweet, we just dissolve.
It's raining, it's raining.
That's right. You knew what I was referring to. That's right.
It looks like Manager Jones went maybe to the wrong meeting.
Well, if he doesn't wish to return, we'll just dissolve. If he wants to, then we'll have then I'll announce we're out of closed session. We'll have a motion to adjourn.
We can't even have a motion.
No.
If we're dissolved, we're dissolved.
I said if we're dissolved, there's no motion. If he's wanting to return, then we do. I say we're out of closed session. I confirm the next regular board meeting, and then there's a motion to adjourn. If he doesn't, then we just dissolve.
I think Manager Zuniga is rejoining. She just told me she is.
Oh, okay. Then we will proceed with the formal process.
Regular order of business.
That's right, regular order of business. Okay, I see that Manager Zuniga has this. So we now have a quorum. Is that correct, Holly?
Yes, that is correct.
Okay, so we are returning from closed session on agenda item 1. Consider and take appropriate action on a complaint made against the Central Health President and CEO pursuant to Central Health's complaint resolution policy for employees who report directly to the President and CEO. We are not required to take action at this time, and so there is no action that we will be taking. I am confirming the next regular board meeting date, time, and location. Managers, our next regularly scheduled Central Health Board of Managers meeting is tentatively scheduled for Wednesday, July 15th, 2020 at 5:30 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. At this time, I'm ready to accept a motion for adjournment. Manager Bell,
that we adjourn.
is there a second?
Second.
Who made the second?
Everybody.
Everybody. Dr. Bell.
Was it Manager Zuniga? Was it you?
That was Julie.
Okay, Julie. A second from
Dr. Bell.
Manager Oliver. We are all in favor? Aye?
Aye.
Aye.
Opposed, same sign. Any abstaining? None. We are adjourned.
Bye.
Bye-bye. Thank you, everyone.
Good night.
So long. Farewell.
Good night.
Good night.
Good night.
Thanks, Sherry.
Thank you.
Thank y'all.